Hi, I'm Paul Jarris, Executive Director of ASTHO. Thanks for watching this video today. I think what you'll see is a very effective program that we at ASTHO offer for state health officials. We have a short period of time in our jobs, and we all need to be as effective and directed as we can. We have complex organizations with many employees, so we really need something to direct those employees in a direction that reflects our priorities as the top health official in the state. ASTHO has developed this program called the Strategic Effectiveness Consultation Program with a gentleman, Tim Fallon of TSI Consulting Partners. We did this after working with Tim for a number of years and having him do our strategic plans at ASTHO, which direct our work and focus us. I think you'll find, as many of your colleagues who have gone through this process has found, that this is an effective, efficient process. At the end of 2 days with your senior staff, you will have a one-page representation of your agenda and your plan for your state. As a result, you'll leave behind a healthier population and a more effective organization, and a true legacy that we all seek. After watching the video, if you have any questions, please give me a call or considering calling one of your other colleagues who have gone through the process. We think you'll find it interesting and beneficial and make your job easier in the end. So thanks for watching today, and I look forward to hearing from you.
In the next few minutes, I'd like to give you an overview of the service that ASTHO provides to facilitate strategic planning processes for state health departments. Up front, let me tell you this. One of the reasons people are reluctant to participate in a process like this is their past experience with strategic planning has been tedious, and it's been so burdensome that, given the choice, they'd prefer a root canal. What we've done is work very hard to make the process both time efficient and to have it deliver the kind of value that really leads to effective implementation and more alignment of the leadership team within the state health department. Let me just briefly describe how the process works, what's done before the strategic planning session itself, a bit of what's involved in that session, and what the follow-up is. Usually, the planning for the session takes 4 to 6 weeks, and it's led by someone that the state health official designates for that purpose, either an individual or a small team. They provide the ASTHO consultants with background information, but the ASTHO consultants work hand in glove with them in all the preparations that the health department needs to do for facilities, to invite people, to provide people with questions to think about in advance of the session. And part of this pre-work is that the consulting team also conducts approximately a 1-hour interview with the state health official to make sure that they really understand that leader's goals for the session. The session itself is a 2-day process that involves key leadership of the department. That is usually the department's senior team, but it's sometimes augmented by other participants to give it breadth of representation and to involve key people that will need to lead implementation. Over the 2 days, the consultants lead this leadership group through the process of assessing the department's current situation, setting its future direction, including confirming its mission and vision, identifying the central challenge it faces over the next 3 years, and developing a one-page strategic map which provides a concise visual summary of the strategic priorities and key objectives that the department sets for the next 3 years. In the second day of the process, we also identify the key 12-month implementation priorities, those tracks of work that need to be emphasized over the first year, and we identify the key results, the deadlines, and the accountabilities for achieving those results. This is an essential part of the process because it makes sure that not only do we end up with a clear plan, but that we've got a very clear path to what needs to happen next in terms of implementation. After the session, the ASTHO consultants are available for approximately 4 hours of telephone support as the department bridges from planning to implementation. There are 4 outcomes of the strategic planning process. The first one is that the department ends up with a clear direction. The second is that it ends up with strong agreement and alignment among the leadership team of the department for what that direction is and what they need to do to lead implementation. The third outcome is increased enthusiasm and commitment, a kind of energy that's built among the planning group that leads them into implementation. And the fourth result is clear path for who needs to do what next to make implementation succeed. Here are the benefits that the 8 departments that we worked with during the first year of implementation reported. First of all, they felt they had a much clearer direction for where the department was going. Secondly, they reported that the leadership team was much more aligned and enthusiastic about moving in that direction. Third, they felt the strategic map, this concise one-page graphic, was a very effective communications tool for working within the department, but more importantly with the governor, with the legislature, and with the public to describe what the department was doing and why that was beneficial. The next benefit of the process is that it's very time efficient. From the show's standpoint, there's a 1-hour interview up front, then there's 2 days for the formulation process itself, and then it's their routine work in leading the leadership team as they move to implementation. From the participant standpoint, they do some pre-work, maybe an hour or 2. They go through this intense 2-day experience, and then they're ready to lead their individual groups in implementation of the plan. The last benefit is the process is very cost-effective. ASTHO has worked hard to make the pricing reasonable for a health department, and they've also got ways of working with conversion foundations in any one of the 50 states to help the state health department secure the funding necessary to support the process. We hope you'll especially consider this process if you're a new state health official. It provides an ideal opportunity to set a clear direction early, build your leadership team, and position the department with the governor, the legislature, and the public as forward-looking and aggressive in improving the health outcomes of the people in the state. I'd encourage you to contact ASTHO and talk with them about this service. They'll be happy to answer any question that you have, and they'll also be happy to put you in touch with your colleagues in other states who have already been through the process so that you can talk with them about what that experience was like and how it was helpful to them. Thank you very much, and we look forward to having the opportunity to work with you.